talk about the muscles of the leg. The muscles of the leg, it is divided into three compartments: the posterior, the anterior and the lateral compartment. So posterior compartment is the largest one, and its function is to plantar flex the foot and flex the knee. So it is further divided into two groups of muscles, the superficial group and the deep group. The superficial group includes the gastrocnemius, the plantaris and the soleus muscles. So gastrocnemius and plantaris, since they originate from the distal end of the femur, they also function to flex the knee. Whereas the soleus muscle, it only plantar flexes the foot. Similarly, in the deep group, there is popliteus muscle, which only acts on the knee and it stabilizes and unlocks the knee joint. Flexor hallucis longus, as the name suggests, it flexes the great toe. Flexor digitorum longus, it flexes the lateral foretoes, and the tibialis posterior muscle, it inverts and plantar flexes the foot. So the nerve supply of this compartment is by the tibial nerve, and the arterial supply is by the popliteal artery and the posterior tibial branch of the popliteal artery. Now let's talk about the lateral compartment of leg. So the function of this compartment is to evert the foot. So muscles here are the fibularis longus and the fibularis brevis. So this fibularis, it's also called the peroneus. So it is peroneus longus and peroneus brevis. Similarly, the nerve supply of the lateral compartment is superficial fibular nerve, and the arterial supply, it's derived from the fibular artery, which is a branch of the posterior tibial artery, which is further a branch of the popliteal artery. So popliteal artery, it has two branches, the anterior tibial and the posterior tibial artery. Now talking about the anterior compartment of the leg, the function of this compartment is to dorsiflex the foot at the ankle joint, to extend the toes and invert the foot. Now the muscles included are the tibialis anterior, the extensor hallucis longus. So as the name suggests, it extends the great toe. Extensor digitorum longus, it extends the lateral foretoes, and fibularis tertius, it dorsiflexes and everts the foot. The overall action of this compartment is the inversion of the foot, but the fibularis tertius or peroneus tertius, it everts the foot. The nerve supply of this compartment is by the deep fibular nerve or the deep peroneal nerve, and the arterial supply is by the anterior tibial artery. So that's it about the muscles of the leg.